Good morning, good morning, good morning. I am sick at the moment, but I do want to come on here and go over a test prep question with you all. This is coming out of the integumentary system, and this is dealing with repair in the integumentary system, okay? I want to show you how I break things down to pass these exams, okay? Now, if you're familiar with the way I do my live, then you know. If not, you better get on to subscribing, because I'm telling you, I'm on the road with the banger. So let's turn the camera around so you all can see how I prep my test questions. Hey there, how you doing? All right. So, y'all, now, as we all know, we're familiar with AAPC and their CPC exams test questions. Now in these days and time, they pretty much doing it to where it's electronic. You can no longer print it out. This was back some years ago, but the good news is if you all have taken that test, then you know already it's still the same question. It's just worded differently, or they got it out of sequence. But however, this is a test question that we all are familiar with, probably. Now, there are going to be some words that I probably mess up, but if y'all know from my live how I get down with some of these words, you're not going to laugh. Some of you all may. But I just wanted to go over the question with you all so you all can know what we are exactly looking for when we come into a test question, okay? Question 1, it states that a 46-year-old female had had a previous biopsy that indicated positive malignant margins anteriorly on the right side of her neck, with a 0.5 centimeter margin withdrawn out, and a 15-blade scalpel was used for full excision of an 8 centimeter lesion. Layered closure was performed after the removal. The specimen was sent for permanent histopathologic examination. What are the CPT codes for this procedure? So as you all see that I have highlighted malignant margins and neck, right? I also highlighted the margin, which is 0.5 centimeter. And I also highlighted the full excision of an 8 centimeter lesion. The last highlight was layered closure was performed. So, as we already know, our answer choices from A all the way to D is talking about repairs, right? So, y'all, I always tell you all to make sure you write these things down in your CPT manual, because there are some things that they are going to trick you up on when it comes to intermediate repair. So I always highly recommend that you all take very good notes in your CPT manual. Not telling you to do a whole lot of highlighting, not telling you to do a whole lot of note taking, but key points is always a must. So if we're going to break down the answer choices, I would like to start with A. So if you take a look at code 11626, that is excision, a malignant lesion including margins, neck, right? Now we do have that here highlighted, malignant margins of her neck. But you guys, do not be fooled now. There's more to the procedure. It was a 0.5 centimeter margin that was drawn out, and it was a 15-blade scalpel that was used for a full excision of an 8 centimeter lesion, with a closure of a layered closure that was performed. So, layered closure. Anytime you see layered closure, you must know that this is intermediate repair, okay? Anytime you see layered closure, we are discussing an intermediate repair. It is more in depth than a simple repair. Simple repair would include one layer closure, but an intermediate is called layered closure. So, and just to make sure we on the same page, y'all, when we talk about complex repairs, it is more extensive, and that's because then the bone is showing. We need to get more in depth with the terms so you all can know exactly what the procedure is requesting for with the problem. Again, you all, I'm sick, so it might come out a little crazy. But, so since we know now that 11,626 code is excision malignant lesion including margins of the neck, we want to keep that in mind. But we also want to make sure we highlight it and get the code for layered closure that was performed. And if you think about it, since we in 12,044, we want to make sure that we keep in mind that it was a 0.5 centimeter margin and a full excision of an 8 centimeter lesion, okay? So when we think about that, we got to make sure we putting the correct measurements in, because if not, the answer choice will be wrong. So this is our answer. Answer C. We have 11,626 as our code, along with 12,044 with a modifier of 51. You all, you see how we broke that down? That is how you will break down your test questions. For more information about this, more than welcome to message me, comment on the video, or you can come through my lives and learn more about test prepping. Don't forget to subscribe.